Thank you for that kind introduction, Dawn. As was mentioned, my name is Dr. Karen Lee, and I'm the Director of School Health with the Sequoia Healthcare District. Today, I'd like to tell you a little bit about our Healthy Schools initiative, best practices in school health programming, policies, and partnerships. First, a little bit about the Sequoia Healthcare District. We're located on the peninsula near San Francisco, 25 miles south of San Francisco and about 25 miles north of San Jose. We reside in the San Mateo County, the lower third, southern third of the county, and we are divided into 5 zones. These 5 zones are represented by each of our board of directors, and it encompasses 230,000 residents. Our area provides services for the most affluent in our area, but also the most needy and vulnerable. So we have an extremely diverse population. Our annual expenses very much represent our annual revenue. In 2020 to 21, here's an example of our expenses of $15 million. As you can see here, the Healthy Schools Initiative accounts for 26% of the expenses, the Caring Community Grants, 25%, major funding initiatives, 19%. Our COVID Emergency Fund last year accounted for 11%. Our pension pass-through expenses, 10%, and programs and administration, 9%. I wanted to highlight our response to COVID-19 this past year. As many of you know, the healthcare districts are in a unique position to help with all sorts of challenges, and in this case, those resulting from COVID-19. Of the 230,000 residents within our boundaries, we directly serve over 60,000 local residents. We are very financially flexible with quick access to dollars, which came in handy, of course, during the pandemic. We have a very deep understanding of our local community. And so we were able to tap into those relationships and connections during this urgent time of need. And our resources have been deployed very strategically. Our 3 COVID investment priority areas include health equity, food security, and mental health. Our COVID response to address the mental and behavioral health concerns have been based on these new challenges that rose during the pandemic. Feelings of depression, anxiety, fear, and isolation, growing levels of economic disparity, institutional racism and health inequities, and a basic lack of access to healthcare. So I'd like to highlight our total mental health investment, both pre-COVID and during COVID. So prior to the pandemic, we were investing $3.3 million annually in this area. And then emergently, we freed up $980,000, which results in the current services of $4.28 million. So a significant portion of our budget. I'm going to transition to the Healthy Schools Initiative. It is the largest program of the healthcare district and really based on the tenet that good health will lead to academic success and that our schools are the perfect venue for these public health interventions. As the Director of School Health, I lead the Healthy Schools team, and we are comprised of 8 from each of the individual school districts. And we also directly support nurses and counselors, mental health providers, PE coaches, those who significantly impact the health and wellness of the school population. A little history about HSI. 12 years ago, back in 2009, the general feeling was that schools had really what they needed, but a local elementary school principal highlighted the need for both programs and policies to help support the health of students and their families, particularly those who are most at risk. So in 2010, Our current CEO, Pamela Kurtzman, embarked on 6 months of research and eventually made a proposal to the Sequoia Healthcare District's Board of Directors. As a result, $1.5 million of school funding was released to launch the Healthy Schools Initiative, supporting health and wellness in 4 of our local school districts. In 2012, we added 4 additional school districts within our boundaries and added some local charter schools. We also launched a PE program called PE Plus in the Redwood City School District, and I'll tell you a little bit more about that later. In 2014, the work was originally based on the CDC's Coordinated School Health Model, which is 8 components. But in 2014, we adopted the CDC's Whole School, Whole Community, Whole Child Model, which is comprised of 10 components. And then today, with a very comprehensive and collaborative approach, we've partnered with many local nonprofits. Our budget is over $4 million annually. And we have focused on the COVID response, mental behavioral health support, nursing services, and substance use prevention. So here's an infographic on the whole school, whole community, whole child model, otherwise known as WISC. And you can see from this broad chart here that it covers a wide range of services and supports. And the child is in the middle and the community embraces them around the circumference. So it truly is a comprehensive coordinated model. So $4 million is our total and approximate total annual investment in HSI. We awarded 16 school grants this past year, and this is an annual competitive process. 8 school districts benefit from the Healthy Schools Initiative support, as well as those local charter schools. And in total, it's 31,000 students served. So I keep mentioning partnerships. They are so important. In our area, we have a very close partnership with the San Mateo County Office of Education. We also partner with our San Mateo County health partners, as well as I mentioned, all of our school districts and our nonprofit partners. An example of a great partnership is with the Peninsula Community Center. Since 2012, this program has helped support PE and a fitness-based program for over 4,000 students in the Redwood City School District. And it's a model that continues to be a gold standard for PE curriculum. I'll share this great quote with you. I was a student at Roosevelt School when PE Plus came. A PE Plus coach named Nick made PE fun and impacted me. I want to be Coach Nick for other kids. So our mental and behavioral health support during COVID amounted to $167,000 of emergency funding to our schools. Not only did it cover mental health support, but also school nursing, PPE, and supplies. A year ago, September 2020, we hosted our very first town hall entitled Mental Health Support in Our Schools During COVID-19. Our CEO, Pamela Kurtzman, and I co-facilitated that town hall, and we invited all of our school partners who support mental health in the schools. We also have a close, longstanding partnership with the Parent Venture. This organization helps support parent and community education, not only in our area, but they now have an international reach, and they actually have participants from Saudi Arabia, England, Germany, and parts of Asia. Some examples of the mental health offerings that we have provided are Mental Health 101, When Should Parents Seek Help, by Dr. Shashank Joshi out of Stanford. This past spring, we had a documentary showing of angst, raising awareness around anxiety. And we also featured Dr. Dave Anderson from the Child Mind Institute. Put the oxygen mask on yourself, parent stress management strategies. We've had over 900 signed up per event through the Parent Venture, so it's been an extremely productive outreach to the community. Now, this is the landing page on our Sequoia Healthcare District website. Under About, there'll be a drop-down and you can access the town halls. Under Schools, you see this drop-down, and I want to highlight Parent Resources. We have 2 school newsletters per year. This is an example of our most recent. And you can see here that one of our resources is the Parent Green Folder. The Parent Green Folder was born out of an idea inspired by the University of California. They had a red folder initiative that provided protocols and resources for their students and staff. So back in 2015, when I worked at the Sequoia Union High School District, we developed a staff green folder with similar protocols and resources. Then when I joined the Sequoia Healthcare District in 2018, my coworker Jenny Bratton and I developed the Parent Green Folder. And as you can see here, it's based on the See Something, Say Something, Do Something model. Signs of distress, academic, psychological, physical, and safety. And then 2 pages of community resources for parents in both English and Spanish. Our DEI efforts have been ongoing for the past 3 years. We've partnered with Circle Up Education out of Oakland, California, and they provide staff trainings throughout our area, starting with trainings on implicit bias. This is a reminder for me to tell you a story about one of our 3rd graders. During Black History Month, she raised a question to our wellness lead in Menlo Park. She said, "Mr. Arrington, why don't the school nurses provide Band-Aids in my skin color?" And so Mr. Arrington is very resourceful. He did the research and quickly found this company out of the Midwest called True Color. And he proceeded to buy skin tone bandages for all of his school sites. When he told me the story, I went ahead and purchased these skin tone bandages for all 8 of our school districts. So now every school nurse has access to these. So it really goes to show the power of a little 3rd grader who saw a need, and it just blossomed into an action item. We partner with Sequoia Healthcare District, partners with Peninsula Healthcare District and the County Office of Ed on suicide prevention. This year we are providing funding through Cognito, trainings for staff and students. They provide at-risk trainings for high school educators, middle school educators, and elementary level. They offer a simulation on trauma-informed practices for K-12 schools. We also have an offering for teens called Friend to Friend that help decrease stigma around mental health and encourage them to reach out to friends and offer them or suggest that they get help if need be. We've also partnered with the Addiction Education Society locally on the Neuroscience of Addiction online program. It's a curriculum that is based on the tenet that addiction is a disease, just like hypertension or diabetes, and that by installing prevention measures and intervening early, that we can make a big difference in the community. This is now embedded in 2 of our local high school districts, as well as others across the country. Again, our parent venture offerings on this topic of substance use, Dr. Anna Lemke from Stanford University spoke about the neuroscience of addiction this past spring, and Dr. Tauhid Zaman from University of California, San Francisco, gave a great talk about cannabis and the young brain. This partnership with the Peninsula Healthcare District, Sequoia Healthcare District, and the County Office of Education is helping to support another organization called Care Solace out of San Diego. They provide mental health resources for students and their families, school staff and their families, 24/7 in any language. And we are committed to providing funding for this effort over the next 3 years. The 3 funders also are coming together to pilot another support called Early Alert. This is based on a model that has been successful in medical schools across the country, and we've adapted it to the school-age community. And these are weekly check-ins, takes about 4 seconds a week. It is a text-based program. There's no app to install, and it's basically a universal screener. But beyond that, it provides resources such as the Green Folder and other resources like Care Solace to those who are in need of assistance. We're looking forward to seeing this program be successful and analyzing the data at the end of the year. So in conclusion, the Sequoia Healthcare District really focuses on best practices using a collective impact approach. We partner with a variety of community organizations and sectors. We find solutions using a common agenda and a focus on equity. We leverage our resources, filling gaps and addressing redundancies. And we collaborate and align our efforts using common measures of success. So with that, I'll wrap up my presentation. You can visit our website as well as our school page. Please follow us on social media and feel free to reach out to me at this email address with any comments or questions. Thank you very much.